So overall, I believe the scientific community and the public are well aware of traditional lipid screening and its use for cardiovascular risk prediction purposes. However, we do know that probably approximately half of individuals who are diagnosed with heart disease end up having normal LDL cholesterol values. And the LDL cholesterol itself, people know as the bad cholesterol, but that calculation doesn't necessarily tell you anything about the number of LDL particles that you have in your blood. All it tells you is the cholesterol contained within those LDL particles. It doesn't tell you, like I said, how many there are or if they're functional, just the cholesterol content. So overall, the more LDL particles that you have, the more risk that you have. It's directly related and correlated, similar with LDL cholesterol. Generally, this test would not necessarily be useful in everybody or the low-risk individuals, so more of your intermediate to high-risk patients. So if you have risk factors for cardiovascular disease, if you're diabetic, if you're hypertensive, if you're obese, if you have a strong family history of cardiovascular disease, that's the population really that we're targeting, and that's where there's a lot of discordance between cholesterol and particle number. And so essentially, like I said, the more particles that you have, the worse off that you are. And so in that subset of individuals, your therapies could be more aggressive, or you'd want to provide more education. We do have relative kind of risk stratification categories, similar with LDL cholesterol, where there's moderate, high, high categories, and so essentially it's a continuum or a spectrum of risks. So generally, the first round of treatment involves trying to educate and advocate for lifestyle modifications, whether it's more exercise, changes in your diet. If that still doesn't prove to be beneficial, so that if the LDL particle number is still high enough or it's elevated, then you would try maybe different treatment modalities or more aggressive statins or fibrates or cholesterol absorption inhibitors. So you could modify the actual therapy based on the LDL particle number. The LDL cholesterol goals keep kind of being driven lower and lower because essentially in the population that you're looking at, your intermediate to high risk population, it's not reflective of necessarily the number of particles. So they keep driving the LDL cholesterol goals down further, essentially to drive the particle number down further. So in your patients who've had events, or if they're diabetic, their optimal goal would be an LDL cholesterol less than 70, with at least less than 100 milligrams per deciliter goal as well. The test is performed using an NMR machine, and it's actually a pretty highly automated NMR instrument, so not a traditional instrument like many people are used to. So this test is not designed or meant to replace traditional lipid screening or testing. It's really meant as a supplement, so it should be looked at as advanced lipid testing. There's still benefit to total cholesterol, triglycerides, LDL, and HDL. It's just that for a specific subset of individuals, again, those intermediate to high risk patients or diabetics, that's really where it's going to have added benefit.